Good. I think we're okay to get started now. That's great. I am Professor Andrew Goudie, Special Advisor to the Vice Chancellor of the University of Strathclyde, and I am delighted to welcome you all to our first webinar in this global, And I'm delighted to welcome you to our first webinar in this global webinar series that we are hosting from the University of Strathclyde in Glasgow in Scotland, and which we have entitled Accelerating Progress Towards the Sustainable Development Goals in the Post-COVID Era, the Contribution of Universities. Many thanks indeed for your enthusiastic response to this invitation. We are really pleased that we have participants, staff and students and other friends from across the globe, including from many of our key international university partners, with whom we have very close and productive relationships in both education and research. I doubt that any of us need reminding of the immensity of the challenge that now faces the world if we are to achieve the United Nations Agenda 2030 vision as captured in the SDGs. Even prior to COVID, our task looked daunting. There had, of course, been good progress in many areas. Many targets were on track, but the Secretary General of the United Nations, Antonio Guterres, summarizes the progress succinctly in his 2020 annual report on the SDGs back in July last year. He very bluntly notes that before the COVID-19 pandemic, progress remained uneven and we were not on track to meet the goals by 2030. He particularly highlighted the rising number of people suffering from food insecurity, the continuing deterioration of the natural environment at an alarming rate, and the dramatic levels of inequality that persisted in all regions of the world. And he concluded unambiguously that due to COVID-19, the achievement of the goals is now even more challenging. The reality is that this COVID era is very likely to be with us all for many years, dominating and disrupting life in every single country until we have the global health crisis under control throughout the world. And even then, as we emerge into the post-COVID period, we will face a long struggle finding the resources to regain our lost ground and to move decisively forward. So the task to deliver the SDGs by 2030 indeed looks all the more daunting. You will probably have seen the latest estimates of the World Bank last month. They consider the challenge from the most fundamental perspective and look at SDG 1, namely by 2030 to eradicate extreme poverty for all people everywhere, as currently measured as people living on less than $1.90 a day. In this context, the World Bank now estimates that in 2020, the number of extreme poor will be around 120 million higher, or 20% higher than what was projected before the COVID crisis for 2020. In other words, the global extreme poverty rate has probably risen to around 9% in 2020. And it is anticipated that the ongoing crisis will erase almost all the progress made in the last 5 years. And of course, as the UN Secretary General observes so starkly, it is important to recall that the SDGs cover a very wide range of economic, social, and environmental goals that provide a vision for all nations. The commitments made in 2015 see sustainable development as a broad, holistic vision with many dimensions, and the impact of COVID on the full breadth of sustainable development on most, if not all, of the SDGs will be profound. No nation has secured the Agenda 2030 vision or is even close to delivering on all the SDGs. So very significant challenges remain in every nation in delivering on both their own SDGs and in their obligation to support other nations to do the same. Universities, of course, contribute to sustainable development, indeed to all the dimensions of sustainability and to the SDGs through a remarkably diverse range of channels. And the diagram there offers one perspective on this, which is interesting. Some channels are concerned primarily with the behavior and conduct of our universities themselves, a more inward focus, such as our energy sourcing, our procurement, our employment policies and conditions, and our travel patterns, to name but a few of our challenges. Other channels focus on the all-important education of our students at all levels of scholarship and equipping them to themselves contribute substantively throughout their lives. Others focus on our research, the generation and application of knowledge and innovative thinking, some with the potential to make a very immediate impact on sustainable development, other research with a longer term horizon, often grounded in more fundamental research. Some channels have a concern to enhance the evidence base and impact directly on the quality of global and national policy development and decision-making across all the dimensions of sustainability, while others are sharply focused on the on-the-ground application of knowledge to very specific real-world challenges. Of great relevance to us today is that the UN has for many years drawn attention to the incredibly significant capacity of universities and research institutes to contribute to the full range of SDGs, all these different channels. Only back in December, the criticality of universities' engagement with the SDGs was once again recognized by the UN Secretary General in a key speech that he made. Indeed, the UN sees universities as having an even greater role in the delivery of Agenda 2030. At successive UN high-level political forums each July in New York, where progress on delivering the SDGs is scrutinized, the UN has repeatedly called on universities to play a key, wider catalytic role in stimulating a dynamic response from across our national civil societies and from our governments at both national, regional, and local levels to proactively demonstrate inspirational leadership in the pursuit of the SDGs. Our fundamental objective in this series of webinars is to look more deeply at how we as universities can contribute, and of course are already contributing. It is to share our experiences, understanding, and insights, to learn how the outcomes of our specific programs or projects are contributing to the overall Agenda 2030 vision, perhaps impacting on several SDGs, and how these programs or projects depend critically on the progress toward a range of other SDGs, but also to share our frustrations and the challenges that have constrained us, held us back in a very open way. Above all, we hope to look to the future, and in this time of huge disruption, focus on identifying the new opportunities that will emerge. As you know, we will be convening webinars each Tuesday now over the next month, with the speakers and their themes coming from one of our global partners, including the University of Waterloo in Canada, KTH Royal Institute of Technology in Stockholm, Sweden, the University of Stellenbosch in South Africa, and Peking University in China, which is a fantastic grouping to have. I'm delighted that today my colleague at Strathclyde, Dr. Tracy Morse, will start us off in this series. Tracy is the head of the Strathclyde Centre for Sustainable Development and a senior lecturer in environmental health. She has many years worked on the challenges of sustainable development and on contributing very directly to the SDGs. She has 20 years of experience working and living in Malawi, where she held a joint appointment at the University of Strathclyde and the University of Malawi, leading on interdisciplinary research team, working on environmental, health-based challenges and solutions. As head of the Centre for Sustainable Development, Tracy promotes, catalyses, and inspires the work of the university, both internally and globally. She will lead this webinar today with several colleagues from across Africa, I'm pleased to say, from Kenya, Malawi, and Zambia, and from the London School of Hygiene and Tropical Medicine. I will leave her to properly introduce them to us in a moment. So a very warm welcome to all of you, and I hope that you will enjoy and participate very actively in today's webinar and indeed the whole series. Thank you very much. Over to you, Tracy.
Thank you, Andrew, for that lovely introduction. And also welcome to everyone as well on behalf of the Centre for Sustainable Development. It's really great to see so many of you here, and I know we have colleagues who've signed up from across the world as well, looking forward to the recording because of them time zone clashes. We're really happy to be kicking off the webinar series today that's been long in the making. And we're going to focus today specifically on looking at evidence that universities can help to provide and support the attainment of the SDGs. We're going to focus on a subject that's very close to my heart and my colleagues' hearts on water, sanitation and hygiene. And I'm delighted to be joined, as Andrew said, by a range of colleagues today. Robert Dreibelbis from the London School of Hygiene Tropical Medicine, Jenala Chipungu from the Centre for Infectious Disease Research in Zambia, Sheillah Simiyu from the Africa Population and Health Research Centre, and Kondwani Chidziwisano from the Washtead Centre at the University of Malawi. I'm looking forward to them sharing all of their experiences and ideas in the panel discussion that will start shortly. But before we get to the panel discussion, I'm aware that we have a very mixed audience today. So I thought it would be good to do some scene setting so that we're all on the same page as we go into our conversation. Once we have our panel discussion, we're going to have about 20 to 30 minutes for a question and answer session as well. So you'll see at the bottom of your screen a little button, I'm sure you're all familiar with it now, for Q&A, where you can click on there and add any questions you may have. Don't feel you have to wait until the Q&A session to add any questions. Feel free to do that throughout. And if you have a question that you're particularly excited about, feel free to give it a thumbs up so that it puts it up to the top and we make sure that we ask it of our panel. So moving on to set the scene. As Andrew touched upon, sustainable development and the sustainable development goals are fundamentally very complex and wicked problems. The pillars of sustainable development of economy, environment, and society can't operate in isolation from one another, and neither can the SDGs. Although they fit nicely in little boxes and squares, they are all widely interdependent. So to tackle them, we need to have evidence, but that evidence needs us to transform the way that we think at the moment. It needs us to think about how we're going to work more effectively across disciplines, how we're going to work more effectively across the different sectors and across our geographical boundaries as well. It's more evident than ever in the current pandemic, which has brought the need for global collaboration into sharp focus. And it's also brought into sharp focus that need for us to share not only successes, but also when things go wrong so that we can support progress. So in order to develop meaningful and impactful evidence, we need not only university research, but interdisciplinary and cross-sectoral working, combining the academic expertise, along with the expertise, skills and knowledge of practitioners, and that of those who are actively benefiting or hoping to benefit from attainment of the SDGs as well. And this together will support our ability to progress these wicked problems and to find a clear and context appropriate road ahead. So today we want to use the area of water, sanitation and hygiene to discuss evidence, and particularly around the attainment of SDG 6. Clean water and sanitation are like a golden thread that are intrinsically tied to all of the other 16 SDGs. Whether it be health benefits from drinking clean water, irrigation to support food security, or climate action to try and prevent water scarcity. As such, clean water and sanitation is and will continue to be an extremely complex and political area, ranging from water access to water quality, from feces containment and management to water catchment and ecosystem protection. But we can't cover all of those issues in one little webinar. So in keeping with my earlier allusion to COVID-19, we wanted, and as the world's attention has really been drawn to the issue of hand hygiene and the importance of washing hands with soap, we wanted to focus on this for our discussion today. So although progress has been made in this area over the last few decades, you can see from these figures that there's still a lot of room to be made and a lot of work to be done to ensure that those 3 billion people worldwide have access to basic hand washing facilities at home. And this is equally reflected in a need to address the lack of hand washing in schools and institutional settings such as healthcare facilities. And becoming more apparent now as well is the need for us to look at public spaces and our workplace environments as well, with the advent of the COVID era. Perhaps not surprisingly, the burden is most profoundly felt in the global south. And within this population, of course, the most vulnerable are the most affected. It's been argued that oversimplifications of interventions over the years have tended to focus on the implementation of infrastructure, of the provision of water, of the provision of hand washing facilities. However, even when water is available, it's been seen that this doesn't always translate into a change in behaviour, and that hand washing and getting hand washing with soap to be a global to the stage of global coverage is much more complex as an issue. We need to look at other issues, areas such as soap access, for example. Although most households in the world do have access to soap, that soap might be prioritised for other activities such as laundry or bathing rather than hand washing at critical times. We might provide a household with a hand washing facility, but if that's put next to a toilet or a latrine, then hand washing with soap at other critical times, such as food preparation or changing children's nappies, is unlikely to happen because it's not convenient. We also need to understand clearly what the motivations are for people to wash their hands and how do we motivate those effectively. And take into consideration that we are all human beings and we're all affected by social and cultural norms that go on in our populations. So in order to get the evidence together to make progress in the hand hygiene area, it's important that we focus not only as a single sector, but encompass researchers, government, non-governmental organizations, the private sector and communities, and the list can go on and on. And we need that to include a range of disciplines, not just the engineers to provide the water, but the behavioural scientists to understand the perspectives of the people we're trying to help wash hands, of the health workers that need to implement these different programs, of the school teachers and business owners that we're asking to change. We want to work in these transdisciplinary teams to ensure that by working together, we are fundamentally asking the right questions, and they're questions that are developed as a wide sector of stakeholders and not just as academic researchers. We want to make sure that those questions ask the right information around diversity, around context, around norms, politics and economies. And we want to make sure that we use the right methods in order to measure success and to measure failures and to share those successes and failures with the right people. So at this point, I would like to hand over to the panel, who are going to be sharing their experiences today of their work in the WASH sector for the last few years, particularly around the SHARE project, which was the Sanitation Hygiene Applied Research for Equity programme. They've been working widely in hand hygiene promotion, not only in the pre-COVID era, but also translating their work with other stakeholders through the COVID era. And they want to also talk about their aspirations and hopes for the acute and chronic post-COVID periods as well. Today's panel will be led by Robert Dreibelbis. So Robert is an associate professor in disease control department at the London School of Hygiene and Tropical Medicine. He focuses on design and evaluation of hygiene behaviour change interventions in high burden settings. And he's also the director of the COVID-19 Hygiene Hub, which is a London school-housed initiative connecting a network of global academic partners to provide technical and research support to COVID-19 response programs. I think all of us who are involved in this webinar today support technical advice on that COVID-19 Hygiene Hub as well. So over to you, Robert, and I'll let Robert give a little bit more of a brief introduction and introduce the panel for today.
Hi, thank you very much, Tracy, and thanks for the invitation and looking forward to the discussion here. Please do flag if there's any audio issues. I know we've all been doing remote things for almost about a year now, but these technical issues seem to be plaguing us all regardless. If you could go to the next slide, please. So we're going to talk again here a little bit more focusing in on hygiene. And Tracy mentioned this, but I think it's worth noting kind of because it helps us understand the context, how we currently measure progress on a global level against for progress on hygiene. So for the Sustainable Development Goals, the Joint Monitoring Program, which is a joint initiative between UNICEF and the World Health Organization, have developed specific indicators that are globally applied to help us understand who has access to facilities and who has capacity for hand washing within the domestic environment. Now, these are arranged in kind of a ladder of demonstrating progress of incremental improvement. And when it comes to hand washing, how we've defined this indicator of hand washing that can be globally applied, our hand washing ladder includes 3 levels. The first is no facility, meaning there's no facility for hand washing on the domestic premises. Limited is that there is availability of a hand washing on premises, but it may lack soap or water at the time it needs to be used. And finally, we have what's considered the basic standard, or what the minimum standard is for hand hygiene, which is the availability of a hand washing facility on premises with both soap and water. Now, we use this because it's data that can be readily incorporated into a number of data collection activities. It's also, we know from studies that kind of having access to a dedicated hand washing station where both soap and water are available increases the probability that someone will wash their hands with soap by over twice. You think about it in your own life. I know here, if suddenly the sink in my bathroom were not there or didn't have soap, the likelihood I would be washing my hands after using the toilet would probably go down just because of inconvenience. And we define these facilities, and they can be mobile, they can be fixed, they can be sinks, they can be jugs, they can be any type of device really kind of set up for hand washing. And soap can be any type of soap that we can use for purification. This can be bar soap, liquid soap, laundry soap, powder soap, whatever can be used for hand cleansing. Next slide. So as Tracy mentioned, we have 3 panelists today that are coming to us from some of our partner organizations from SHARE, all of whom are global experts in the field of hand washing and hygiene. And I have had the pleasure of being able to work with everyone on this panel for the past several years. So very excited to be kind of working with all of you again. So the 3 countries that we'll be kind of discussing in a little bit more detail today are Kenya, Malawi, and Zambia. One more slide. Just to give you an overview, Kenya currently has a population of about 46 million people. 26% of those are in urban environments. Malawi has a population of 18 million, about 16% of those living in urban environments. And Zambia has a population of 13 million, about 45% of which are in urban areas. And looking back to the hygiene ladder, where we have the no services, limited services, and basic facilities, we can see kind of quite a bit of differences even between these 3 countries in terms of the kind of the proportion of the population with no services in the domestic environment. In Zambia, that's as high as about 60% of the population do not have a dedicated location in their home where both soap and water are available for hand washing. In Malawi, we see about 45% of the population. These numbers, I apologize, I mistyped one of the numbers. That bottom part should not be 16. But about 45% of the population who do not have access to a dedicated hand washing facility within the home, because there is either lack of water or lack of soap. And finally, for Kenya, we see quite a bit of we see higher rates of coverage in terms of basic facilities. About a quarter of the population has access to a hand washing facility in the home, but still a relatively large proportion of the population without access to a hand washing facility, 40%. So this is just some broad background. Now we're going to introduce the panelists now. I'm going to ask them to turn their cameras on. Our first panelist is Sheillah Simiyu. Sheillah is a researcher at the African Population and Health Research Center in Nairobi, where she heads the subunit on water, sanitation, and hygiene within the Urbanization and Well-Being Unit at the center. Sheillah's research focuses on WASH issues in urban and rural areas across sub-Saharan Africa, and she's worked on a number of studies in Kenya, Uganda, Tanzania, and Ghana. Sheillah holds a master's degree in environmental studies and public health from Kenyatta University, and a doctorate in public health and development management from Stellenbosch University. So thank you, Sheillah. Welcome. Our next panelist is Kondwani Chidziwisano. Kondwani is a researcher at the Washted Institute in Blantyre, Malawi, and an academic member in the Department of Environmental Health at the University of Malawi, the Polytechnic. He's currently completing his PhD with the University of Strathclyde, and Kondwani's been conducted various research studies, which includes formative research, evaluation studies, and interventional studies around hand hygiene. His primarily interests are in designing and implementing WASH behavior change interventions to improve community health in low-income settings. So welcome to Kondwani. And finally, we have Jenala Chipungu. Jenala is based in Zambia and is the Social Behavioral Research Fellow with the Center for Infectious Disease Research Zambia. She has an MPH from the University of Liverpool and a Bachelor of Science from the University of Zambia. She's been working in behavioral science research for the past 7 years, particularly around hygiene, exploratory research in hygiene, intervention design, and intervention evaluation. So please join me in welcoming these panelists, and we're going to now move to just an open discussion. Now I can see you all, so hi.
Hi, Robert.
Thanks.
Thank you.
So one of the ways that I've been able to kind of work with all of you over the past few years is through the SHARE Consortium. And now the SHARE Consortium, just to provide a little bit of background, was a then DFID, what is now FCDO, funded initiative at the LSHTM that went through various iterations over several years, focusing on addressing water, sanitation, and hygiene challenges in specifically in the latter iterations, focusing specifically on sub-Saharan Africa. Now, within SHARE, I know that all of you were involved with research initiatives and the design and execution of some really critical research projects that were occurring within that we were working with you on during the SHARE Consortium. So could we just take a minute and using this as a framing device, could maybe we go one by one and each of you explain a little bit about the research you were doing as part of the SHARE project and the hygiene gap that you were kind of addressing with that research. And then we'll kind of take it from there and discuss kind of various ways that academic partners can contribute to addressing the sustainable development goals around sanitation. So with that, first, why don't I start with Sheillah? If I could start with you and tell us a little bit about the research that you were part of as part of the SHARE Consortium. I think you're still on mute, Sheillah.
All right, thank you. I hope everyone can hear me now. All right, thanks, Robert, and thanks to everyone for attending. I will not introduce myself, but I'll talk more about the SHARE project. So, together with the partners from the London School of Hygiene and the London School of Hygiene and Tropical Medicine and the University of Iowa, we were implementing a randomized control trial to reduce enteric infections that cause diarrhea among infants, particularly in low-income urban settings. Now, this study was based on the gap that most of the diarrhea infections that we have, actually close to a third of them, are foodborne. So therefore, we implemented an intervention, a hygiene intervention specifically to improve food hygiene practices at the household level, more specifically by working closely with the primary caregivers of infants. And we encouraged these primary caregivers to practice 4 key behaviors. One, by practicing adequate hand washing with soap and water before food preparation and infant feeding. Secondly, to hygienically feed their infants using specific household items or specific food items that were designated for the infants and not to use them for any other purposes. Thirdly, we encourage them to heat or reheat infant food to a boil before feeding the infants. And fourthly, we encourage them to store infant food in sealed and hygienic containers. So we did this by designing what we defined as educational and motivational messaging items, and also by providing hygienic items to encourage or promote the uptake of some of these behavioral aspects that we were promoting. More specifically, we provided hand washing containers, and we provided feeding items. That is probably, we provided spoons, we provided feeding bowls, and we also provided food storage items that caregivers could use to store infant food. Yeah, I think basically that's a wrap up of what we did. Thanks, Robert.
Great. So yeah, interesting there. An example of, we often think of hygiene and often narrow that down specifically to just food hygiene. So an interesting example of how even something as simple as hand hygiene does have these kind of massive intersections with things like complementary food hygiene and other routes of exposure. So kind of the interdependence of all of these relationships. I'm going to move over to Kondwani next. If you could kind of tell us a little bit about the research you were doing, kind of if we're thinking about kind of the share period and the pre-COVID era of some of the hygiene gaps that you and your team were working on.
Thanks very much, Robert and the team. Let me start by saying that diarrhea remains one of the leading causes of death among children aged 5 years and below. And the food has been identified as one of the main contributing factors to childhood diarrhea. However, existing programs have focused much on nutrition, specifically food supplementation, and the provision of sanitary facilities, for instance, toilets in the communities, while there has been little attention to food hygiene practices at household level in these rural settings. And it is against this background that we designed and implemented an intervention to improve food hygiene behaviors at household setting in the rural communities of Malawi. And let me say that the key outcomes of the study by the end of our intervention was reduced diarrhea among children who participated in the study. And this reduction in diarrhea was linked to observed hygiene practices that were targeted study. So briefly, this is the kind of work that we implemented under the SHARE Research Consortium in Malawi. Thanks, Robert.
Thanks. And just as a quick follow-up, kind of building on Sheillah's, she talked about quite a bit of kind of how the intervention was designed in Kenya, which included, distribution of new hardware to the homes, hand washing facilities, safe storage containers. What were some aspects of the intervention? Kind of how did you go about changing hygiene behaviors within your specific intervention context?
In our context, generally, we used a number of communication channels to change the behaviors. We used the cluster meetings, whereby the child caregivers used to meet and discuss issues. But also, we used to go into the households, whereby we were conducting household visits using the community volunteers. So, for instance, when the women were meeting in these groups, within their groups, they were able to learn from one another how they can promote the targeted behaviors. So it's like using role models who are already performing the behaviors, sharing to others how they were doing it. And that also motivated those who are not performing the behaviors to perform these behaviors. But also importantly, we use the cues for action, the reminders, whereby, for instance, using the bracelets, using the bantings, and the key messages that were put within the household setting. And when the caregivers could see this, it acted as a reminder to perform these key behaviors. So these were just some of the approaches we used. So it's like we were moving away from the health education approach, whereby you just give people knowledge and not demonstrating to them the effectiveness of, for example, of soap in removing the germ. So they could be able to see how soap was effective, and that really motivated them to practice the behaviors in this case.
Great, and so finally, third in our list, Jenala, kind of over to you. If you could tell us a little about some of the pre-COVID research and the hygiene gaps that you were working on with your team at CIDRS.
Thank you, Robert, and thank you everybody for joining. I'm happy to talk about our project at SHARE with you today. So yes, we wanted to contribute to SDG 6 by improving access to basic sanitation. And I must say, at the time that we were given this task, we didn't know what we're going to do. And so we needed to go into the field and understand exactly what the barriers were when it came to sanitation. And there were so many problems. We worked in a community called Baulani, which has approximately 70,000 people. So it's quite densely populated. And what we did find is that toilets in these communities are largely in poor condition. So it's just a basic latrine and very unkempt. But we also looked at how we could improve the sanitation facility within these communities. We found that most toilets were shared. In fact, about 80% of the toilets are shared among 5 to 6 households on average, and up to 15 people on a plot shared a toilet. And what was interesting to us is the landlord lived on the plot with the tenants. And so when we got back from the field and looked at where the gaps were, we found, Robert and everybody else, it was important that we not only look at basic latrine in terms of how SDGs defined it, but what is a real improvement. First, one of the issues we found is that the toilets were not clean. Many toilets were not clean. And we looked at how can we improve cleaning activities amongst people that use the toilets on the plot. And so our first key behavior that we targeted was toilet cleaning, but using a rota system. The second one involved, the second and third one involved installation of an outside lock. And the outside lock was really to prevent others from using the toilet, because many of these plots are not enclosed. And so the toilet is open for anybody to use. And that was a problem. And so we needed to have landlords install an outside lock to prevent use by others. And then we also promoted an inside lock, which was promoting privacy. Because again, many toilets did not have an inside lock, and it was uncomfortable to use the toilet when the door kept on opening. The last improvement that we looked at was a water-sealed pan or a hole cover to basically prevent bad smell and flies within the toilet. So those are the 4 improvements that we targeted in SHARE, and we used a randomized control design as well. We developed an intervention that was entirely community-based. And this intervention focused on engaging landlords. And we chose landlords because in our formative research, we did understand that landlords were the holders of the money, but also seen as the ones responsible for making these improvements on the toilets. And so they were an ideal target for our intervention. And so we carefully mapped out the community and had organized landlord meetings. So we engaged landlords through invitations. And what was nice about this project is that we didn't tell landlords, well, please come for a meeting to talk about your toilets. No, we told them come for a meeting so you can learn how to make some money using your toilets. And so it was the motivation to bring them to the meeting. But it was true in part of our teaching or our behavior change techniques that if they did improve their toilets, they would have the opportunity to talk with tenants around increased rentals for better toilets. And so we had landlord meetings that were very carefully structured, well thought out. We used video for problem identification. So we showed landlord the videos of the real stories that came out in the formative research for them to understand what the tenants were saying about the toilet and identify ways in which they could improve the toilets. And that identification process, we used emotional demonstrations and games to see what is the best way in which we can address this problem. And third in the meeting was then how do you then operate a function of cleaning rota at your home? How do you install an inside and outside lock without so much investment? And so we brought masons in and showed very simple ways of how you could improve your toilet and also make these installations. And so it was a really fun intervention. And I'm very happy to say that we did see change between our control group and our intervention group at the end of the intervention.
Great, and you hit on one of the follow-up questions here about kind of the process of engaging with our kind of, we often identify around hygiene and wash interventions broadly, specific people we want to change their behaviors in certain way. And you talked about kind of engaging with landlords and providing them with kind of alternative ways, not just education, but providing them with new incentives to adopt kind of improved sanitation facilities or more hygienic facilities in your environment. can you tell us a little bit about kind of how you engaged with other beneficiaries? So what was the process of kind of identifying this as a pressing need for people within those communities?
Thanks, Robert, and that's a really important question that you raised. One of the things that was important was working through the community structures. If we had gone straight to a household to talk to a landlord, we would not have been allowed. In fact, we'd probably be seen as a local authority. In fact, some households thought we were local authorities trying to collect money, and some others thought that we were Satanists, you know, trying to bewitch somebody in the house. So what we did was work through the health facility structure. So most communities in Zambia are managed by the health facility, and the health facility has a community cadre that's called the neighborhood health committee member. These neighborhood health committee members have a wealth of information because almost every project, water, sanitation and hygiene, nutrition, use the NHCs to promote health in the community. And so it was important that we work through this structure. And so what we did is we first had meetings with the health facility in charge, who then identified the key and active NHCs within the community. We sat and discussed the project with them, but what was even more important for us is that they helped us recruit the landlords, which gave an opportunity for NHCs to have the privilege of sensitizing the landlords at household level and also giving an introduction to the project. That is extremely important if you're going to go and implement an intervention. It has to be seen as bought by the community, and it has to be owned by the community themselves. And so working through the NHC structure really helped in terms of having the project accepted, especially that we didn't have any hardware. We didn't promote any hardware. This intervention was purely behavioral based. And so it was also important to manage expectations among the landlords. So we did work through the community structures, and that way landlords welcomed the project.
Great. And thanks. And building on that, I know, if we want to see real progress on any of the SDGs, and particularly around hygiene, we're going to have to move beyond these individual projects or individual initiatives and really make sure that these are integrated and aligned with larger government strategies. Kondwani, could you tell us a little bit about kind of how your team and how you have been approaching working with local stakeholders and with government partners with your research, whether that's uptake or the design of the projects, or just how that engagement is happening at the local level to ensure kind of scalability and sustainability of improvements?
Thanks very much, Robert, for that important question. In research, collaboration is very important at different levels of the society. So from our case here, when we implemented the shared research project, we engaged stakeholders at different levels. For instance, at national level, we engaged the central government, specifically the Ministry of Health, the Ministry of Water, but also the donor community, which included the UNICEF and WHO, but we also engaged the parliamentarians. And we engaged these people through the research advisory group that we formed during the initial stages of our research. The purpose of this particular grouping was to ensure that these key stakeholders are taking an active role in providing important suggestions as we were developing the interventions. And really engaging, working with them from the beginning helped quite a lot to include important elements as we were designing, delivering, as well as evaluating our intervention here in Malawi. While at district level, we worked hand in hand with the decentralized offices of the government, specifically in the district where we implemented the research, but we also engaged with the local NGOs down there. And the purpose of doing this was to assess whether the intervention, the proposed intervention that we had was appropriate to the society, but also whether it was acceptable. While at the bottom level, we engaged the communities themselves. And this was done through the local chiefs. And this was done purposively because the local chiefs have an influence within the communities. In most cases, people who listen to what they say. So we wanted to ensure that they are part and parcel of our project, and that is also important for the sustainability of the intervention that we came up with. But also we engaged or we worked with the community volunteers who are existing structures in these particular communities to deliver the interventions. And these were assisted by the community health workers who are government workers working at grassroots, assisting community members with public health interventions. And this was really related to our work here in Malawi. Thanks very much, Robert.
Great, thank you. And kind of going back to kind of some of Tracy's earlier kind of presentation, talking about kind of these challenges as intractable problems and really requiring kind of transdisciplinary or multidisciplinary work. Sheillah, I wonder if you could comment a little bit on kind of the experiences that you've had working to address hygiene behaviors from an interdisciplinary perspective and the benefits and challenges that you face through that process.
Yeah, thank you, Robert. I would begin by highlighting, now that I've already given a background of what our study was about, I'll begin by highlighting three main areas. One, the different disciplines that we had in the project, and then two, how the kind of stakeholders that we engaged, and thirdly, the benefits and the challenges that we faced or we saw. So beginning with the issue of the different disciplines that we had, right from our own team, we had people with different disciplines. We had people who had a laboratory background because we needed to measure some of the outcomes of stool. We had people who had a more social background. We had people who had a public health background. We had people who had a nutrition background. So it was interesting to bring all these views together so that we don't work in one discipline, so to speak. Engaging all these other disciplines ensured that we were able to draw from these different disciplines to then bring together all our knowledge into one direction, that's towards the intervention. So secondly, I'll talk about our engagement. I've already mentioned that we were trying to promote food hygiene, and we did that by promoting hygiene at the household level. And we engaged both the county level stakeholders, and we also engaged the community level stakeholders, more importantly, the beneficiaries. So at the county level, we had, more importantly, working with stakeholders or leaders, should I call them policymakers, who are from the Ministry of Health. So any initiative that we needed to promote within the community had to be in line with the county government's initiatives. So in designing our educational and motivational messages, we worked very closely with the county government in designing these messages to ensure that not only did they resonate with what the county government was putting out there, but it also was understandable to both the county government officials and also the community. Now, concurrently, we are also working with the beneficiaries or the community, the household level. Now, we did this through several sessions where we tried out the interventions, the kind of hardware that we wanted to promote, both the hardware and the messaging that we wanted to promote. For example, when we wanted to finally settle on an appropriate hand washing facility, we had to buy an item and then take it to the community so that they could try it out. And for us as the researchers, we had to go through a session of learning, understanding, and also unlearning the views that we had. Remember, I've mentioned that we were all from different backgrounds. So it was a very interesting process of both learning and unlearning. And also, as we all learned and unlearned, we ended up coming up with an intervention that was both acceptable to the Ministry of Health, acceptable to the researchers, and acceptable to the community. So that in itself is already a benefit, because that process enabled us to come up with an intervention or a package that was acceptable not just for the end result, the users, but also for us as the researchers and also the county government level people, for instance, the Ministry of Health, so that then any intervention that we brought up was acceptable at the county level and also at the community level. But it also came with challenges because you can imagine bringing all these different disciplines and all these stakeholders is not easy because everybody has their own opinion. So one of the main challenges was that, for example, county level staff are, as we all sometimes say, they are busy people and we may not always have them in meetings. But for us, once we learned that, what we did was to initiate discussions with them earlier on in the project and to identify a person who had an interest in the project. So in subsequent meetings, these people were not only part and parcel of the team, but they also contributed relevant information that was very key for us. Also with the community, the benefit was that we were able to design something that was acceptable for the community members who eventually became the end users. The other challenge is maybe just the challenge of having to take all these different opinions together, but I wouldn't call it a challenge. I would rather call it a good challenge, because that's a good challenge that then for us researchers, we are faced with the challenge of saying, how do we bring all these things together so that they make sense? So it was a challenge, but it was a good challenge. Thank you.
Okay. And on the subjects of challenges, I think it's a nice way, and what we can universally agree is not a good challenge, has been the impact of COVID-19. We heard earlier in this webinar kind of the large scale societal level changes due to COVID-19, the number of individuals that are kind of expected to kind of go back or stay in poverty. I think for those of us who are doing hygiene research, we've been in a very kind of unusual position that, you know, we're actually kind of moved to the front line of COVID-19 response in a lot of ways. But we also, you know, with all of the work that all of you have been doing, you know, really do understand what some of the existing challenges are related to hygiene, and kind of are able to apply this knowledge to kind of what COVID-19 has presented, or the new challenges related to COVID-19. I wonder if you could all briefly kind of mention one specific example about how you have been addressing COVID-19 within your own country or within your own kind of partner networks. I'll start with Kondwani for this one.
Thanks very much, Robert. With the knowledge that we gained, experiences and expertise we gained from the Sheillah research project, we've been able to work in the prevention and control of COVID-19 pandemic in Malawi. For instance, we've been working with the healthcare facilities here to provide protection to the people within these settings. Let me give an example of the work that we have done. We have worked in the guardian waiting shelters in the hospitals. So the guardian waiting shelters are temporary residential homes in the healthcare facilities that provide the dormitory type of accommodation for the care of patients. So with the coming in of COVID-19 pandemic, there has been increased hospitalization, and this has given too much pressure to these particular waiting shelters. Let me say that the guardian waiting shelters are positioned very close to the health facility, and these are basic structures, and with the limited water and sanitation facilities. And specifically, with the COVID-19 pandemic first wave, the healthcare facilities focused much of their attention in the control of the pandemic, trying to control the pandemic amongst the healthcare workers and the patients. And there was limited attention to these guardians of patients in their waiting homes. So we rapidly implemented a hygiene promotion program whereby we promoted hand washing with soap, mask wearing, physical distancing of these particular guardians within the waiting homes, and also to encourage them to perform these behaviors as they are going back to their respective homes. So it was like a way of trying to ensure that the behaviors they are acquiring within the hospital setting can also be introduced and promoted in their health settings, in their home settings, I should say, to prevent further spread of COVID-19 in Malawi. Thanks very much.
Great, and I know, yeah, everyone's been doing so many different initiatives. Jenala, I wonder if you could kind of talk about one of the initiatives that you've been involved in Zambia of building on your expertise in kind of COVID-19 response.
Sure. So it has been quite a busy year because I do realize there are very few people who are hygiene specialists and experts. And so the demand for this expertise has really come up this year, both at the national level, but also amongst networks. We do have the opportunity to be technical advisors on the Hygiene Hub that's hosted by the London School of Hygiene and Tropical Medicine. And through this forum, one exciting opportunity that we have is with the World Bank and a local utility called the Lusaka Water Sewage Company utility. And the main responsibility for this utility is to provide water and sanitation services to the whole country. But as you can imagine, as Robert showed, a lot of Zambia's population is in the peri-urban areas. That's unplanned. And so there are a lot of challenges that lie there. So this project is really based on a huge funding, about $65 million investment within the Lusaka Water and Sewage Company to provide water and sanitation services within the country. But one of the key components of this funding is also the promotion of hand hygiene messaging, as well as hand hygiene infrastructure and menstrual hygiene infrastructure. Now, with the coming of COVID-19, Lusaka Water and Sewage Company have seen a huge decline in the service uptake of these services, water and sanitation, but also we're very proactive to include the new messaging coming in, the new behaviors that come with COVID, which are social distancing, hand hygiene, and face masking. So the project had to remain relevant within the COVID-19 era. And what they did is they did include messages around prevention of COVID-19. But even though that happened, there are still challenges in one, trying to understand what progress is being made amongst these hygiene indicators, but also trying to understand why have services gone down, especially at a time when water is critical and the use of sanitation services are critical. And so through this collaboration with the Hygiene Hub and the World Bank, we have the opportunity now to answer those key questions. And so we've soon be answering one, what is the relationship between COVID-19 and the plummet in service uptake in this utility? But also more importantly, how can we measure hygiene messages like hand washing with soap and menstrual hygiene in such a huge project? And so one of the outcomes of the project will be to assess, will be to develop an M&D tool that can help the utility measure progress amongst the hygiene indicators as well as service uptake.
Yeah, an interesting project that kind of shows the complexities of how, you know, we see these impacts of COVID-19 on, you know, on municipal providers, how this may have long-term effects on people's ability to manage hygiene or sanitation within the home. So thanks. Sheillah, can you tell us something about kind of one of the COVID-19 response programs that you've been engaged with in Kenya?
Robert. So moving on swiftly from the SHARE project, which was, as I've mentioned, a household level kind of intervention. At the Hygiene Hub, where we all are technical experts, I am now involved at a country level where I am involved in evaluating an intervention or a project that was implemented right after the onset of the pandemic within the country. Now, what happened is that after we had our first case or our first cases of COVID-19 in the country, we had several organizations that came together, both from the private sector and from the public sector, to kind of provide initiatives that will encourage, that will curb the spread of COVID-19. And one way of doing this was to encourage hand washing with soap. So these organizations brought in resources, and they also developed messaging both in print media and also in the local media, that is through local television stations, just to encourage specifically the the prevention of COVID-19. Of course, we can talk about the social distancing and the wearing of masks, but also more importantly, to encourage hand washing with soap, especially at public spaces. So we had these organizations drum up resources to install hand washing initiatives or hand washing stations within the country, and also to provide soap to within these hand washing stations. So at the Hygiene Hub, and as a technical expert, we are involved in evaluating how these interventions have been effective in reducing the spread of COVID-19 within the country, or within Kenya specifically.
Thank you. I will back up for a minute. I skipped over a note in my own run of show here to kind of tell a little bit about the Hygiene Hub, of which kind of everyone here is engaged in one of the technical partners. Tracy mentioned this earlier. The Hygiene Hub, it's an LSHTM housed initiative. So we're based at LSHTM, but what we do is we bring together technical experts and partner them with organizations, with NGOs, with government partners, with civil society organizations to provide technical expert around COVID-19 response programs as they relate to hygiene. And I think everyone here has been working with us, and we've been able to kind of leverage a lot of expertise both in country and globally of building on the kind of this, you know, unlike something like mask use, which is predominantly a new behavior where no one really knows how to go about this. We have been doing work on hand hygiene for quite some time and really trying to leverage the capacity that we know about how to develop innovative and successful hygiene programs and apply those lessons to COVID-19 response. So again, I do want to thank all of the presenters here for being part of that. And it's interesting to hear more about kind of the programs that you've been working on as part of that global response. Now, I know COVID-19 hasn't just changed the priorities that we've gone about, but it's also changed a lot of the relationships and how we go about addressing kind of these sustainable development goals, even if they are more pressing than ever. Tell us a little bit about how your work has changed with engaging stakeholders and communities as part of COVID-19. Sheillah, I'll start with you. If you could share a little bit about kind of the stakeholder engagement process you've been working with as part of your broader public hand washing facility work.
All right, thank you again, Robert. Just to also take us back to what I've shared before is that we, as a country, we have been implementing interventions to promote hand washing alongside other interventions. So in this particular intervention, we have brought together both the private sector and the public sector. The private sector would be, in this case, would be classified as organizations that would dominantly, would more importantly be working within the private space. And these are organizations, for instance, the Rotary International, that we probably have all heard about. But these private organizations are also working closely with the public stakeholders, or the public and public sector or public level, more specifically the Ministry of Health. And so to give a perfect example is that during the outbreak, in as much as we had a public outcry that we need to prevent, we need to come up with these initiatives, we saw a lot of working together between the ministry, which is the public level, and we also saw all these different stakeholders coming together to work together towards a common good. So the Ministry of Health in its mandate identified areas that they would be defined as high-risk areas that necessitated the immediate installation of hand washing stations. And the private sector, on the other hand, they mobilize resources, both financial resources and in-kind resources, like, for instance, soap and hand washing containers. So this is a scenario where we have brought together the private sector, we have also brought together the public sector, and they're working together towards improving a common goal, which is not only preventing COVID, but also improving or encouraging hand hygiene amongst the public space or among the population within the country. Thank you, Robert. Happy to answer other questions.
And Jenala, tell us a little bit about your experiences in Zambia, how the COVID-19 has changed the relationships among stakeholders, and how you can go about still promoting kind of progress against these SDGs within the context of the COVID-19.
Thanks, Robert. I think one thing that's important to appreciate, and one thing that I have learned during this pandemic, is that the Ministry of Health and other key national stakeholders and ministries are under serious pressure when it comes to such a huge pandemic. They're expected to address things very quickly. Messages should go out very fast. They're expected to report progress at the national level, and so everybody is under pressure. What is nice is that there is a forum that is created called the Risk Communication and Community Engagement Group, which I am an active member of, that tries to deal with how we can communicate with the public about what's important in a pandemic, with emphasis on COVID-19 prevention behaviors, including hand washing. Now, we have been promoting these messages, these behaviors for a while now, but it's almost like we forget about everything that we're doing, and what we want to do now is stop the pandemic. And it's extremely under pressure. And so what we did notice as an institution is that many of the messages coming out were very reactive to the pandemic. And we know that there are techniques in which to convince somebody to wash their hands, or convince somebody to stay a meter apart, or to wear a face mask, which is not telling somebody wear a face mask, or wash your hands with soap, or stand a meter apart. That is not going to cut it in a pandemic, but also in a country where we face so many barriers that have already been talked about. And so my engagement with the RCCE was interesting, because you have to work with a team that's already under pressure. So what we brought to the table was another way in which you could communicate the complexities, one, of practicing these behaviors, but something that could actually move somebody to make changes to their behavior. And what we used was stories. So what we did is come back to our desks and said, let's create a drama series that's focused on storytelling. And this drama series brings to light what the difficulties are. Public transport here is difficult in terms of practicing social distancing, because people have to make money. And if you do say social distance in a bus, then you are reducing the income that person is making. And so it's extremely difficult. Hand hygiene in public spaces as well, at markets that are highly densely populated, is very difficult to practice. And so what we try to do in this drama series is focus on a character that is really our mantra of the message, but also goes through different touch points or different spaces, like work, like the market, like the bus stop. What happens in times of COVID? What can you do within your context? What is realistic? Promoting things or aspects like community, trying to take care of your neighbor, for example. Take care of your neighbor, check on your neighbor. Do they have soap? Are you reminding them that you should stay a meter apart, rather than put a poster or a message on TV or radio saying, stop this? So it was interesting, because we created this fantastic radio drama series, and we have to get approval from the ministry before airing it. So we thought it was going to be an easy step. But when we showed this, when we made the RCC listen into the radio drama series, it was interesting that they were not very convinced, because it was a story. And so it was like, no, but why don't you just say the message? Why don't you say, wash your hands with soap? And so we realized we needed to workshop this drama series with the RCCE stakeholders, take them out for 2 days and really try to make them understand exactly why we're using this technique of communicating messages. And it's okay in a story to show the complexities, because people can think through them and try to come up with their own solutions, because their motivations for practicing those behaviors is different. And so it took about 2 to 3 days for us to finally work with the ministry as well as the RCC stakeholders, which was very nice, because I think at the end of that meeting, we all got a round of applause for the storytelling. And I must also give credit that because we used artists, and so it was not only us, but the radio drama series got a round of applause from a team that in the beginning was not convinced that this should go out. And so it's important, therefore, to take a step back and really trying to bring to light what behavior change techniques do we use as experts in this field, and how can we work with important stakeholders to make them understand that telling people what to do in a pandemic may not help, but we need to really learn from what evidence suggests.
Great. And I want to use this moment of optimism about using a successful campaign and engaging with new stakeholders, and let's build on that and think about kind of now as we globally transition, hopefully in many places, to kind of out of the acute phase of the COVID-19 pandemic to more what we're kind of maybe a long-term response or the post-COVID era. What do you see as kind of some of the remaining challenges around hygiene within your country or within your local context, and how can we address those? And then if we could keep the answers here relatively short so that we can move on to kind of Q&A. And I'm sorry, I'll start with Kondwani. What do you see as the #1 challenge around hygiene in the post-COVID era?
Thanks very much, Robert, for that important question. What I can say from COVID-19 pandemic in relation to hygiene is that we have seen a lot of people practicing hand washing with soap recently. Possibly this is happening because they are afraid of getting the pandemic. And we are not sure what happens after the pandemic, assuming that the pandemic will go away from us, and that's what everyone is expecting. But mostly, if the pandemic goes away, there's a chance that people will revert to their normal behavior of not practicing hand washing with soap. And maybe that's something that we as researchers, we may need to think about, to say, how can we sustain this kind of hand washing momentum that we are experiencing at the moment? How can we ensure that this continues, whether we have the pandemic or we don't have the pandemic? I think that's one of the key areas we really need to consider as we move forward towards attainment of the Sustainable Development Goals, especially goal number 6.
Sheillah, what do you see as the kind of pressing hygiene priorities in post the acute COVID response phase?
Thank you, Robert. I will go back to the slide that you showed initially, which is on hand hygiene. And so I tried to summarize by tying that with the hygiene intervention that I've just talked about hand washing in public spaces, and say that we need more evidence, more robust evidence, so to speak, that will guide both research and practice on how to encourage hand washing with soap and water, especially in the public space. Thank you.
And Jenala, what do you see as kind of the main challenges around hygiene? So.
I think that this has brought an opportunity for us to really think about how we can be better prepared for the next pandemic. We do know that pandemics are going to come, but how do we hold hands as hygiene experts to ensure that when the next pandemic comes, we do have an already existing hub locally that knows exactly how to address this challenge in times of stress. And so for me, it's really about creating those systems and those structures that are resilient to pandemics and ensure that we're still meeting our SDGs even among pandemics.
Great. So thank you all for sharing your experiences here. I'm kind of paying attention to the chat, the Q&A here. And I don't know if Tracy, you wanted to moderate that component, or happy to.
Yeah, I can jump back in because that way we can ask you questions too, Robert. Sure. So who's you on the firing line? There you go. Great. So thanks, guys. That was really interesting and inspiring, and having worked for you for years, and it's always still wonderful to hear you talk about your different projects. And I'm sure lots of people have been interested to hear that too. There's a few different questions, so I'm going to try and fire them at certain people. I'm going to target Robert first, since he's got off with asking the questions so far. And there's a great question here that says, should we be describing SDG 6 as a keystone goal with the advent of COVID? I know this is kind of a biased panel to be answering that question, but.
I think I would do this maybe with a bit of caution as we think about kind of, the way we've set up the Sustainable Development Goals. You would be hard pressed to find one Sustainable Development Goal that in some way isn't nested within this interdisciplinary or this kind of interconnections between all of them. I do think, personally, I am quite biased. I do think that this Sustainable Development Goals around water, sanitation, and hygiene are intimately related with many other ones: child mortality, economic well-being. We haven't even discussed the relationships with kind of access to services and experiences of violence and experiences of safety. So there are a number of relationships here, but all of these goals are so interdependent. I think what it is, it's a great example of understanding how we can't focus on just one aspect of these. We've really got to make sure we're addressing all of the Sustainable Development Goals simultaneously, and that hygiene is one of the very crucial ones in part of this larger network.
It's almost like I set you up with that, Robert, for an answer for the centre. Thank you. Oh, Kondwani's popping back in again. That's good. I thought he was avoiding questions there for a moment. Sheillah, I wonder if I can fire one at you from the group discussion, and it's thinking about your public spaces. And I think certainly in Malawi, we saw a rapid escalation of innovations and things around making hand washing facilities, for example, for public spaces and even for households. And someone was asking about the need to enable local production of soap and of these hand washing facilities within country to try and promote hand washing. I wonder if you want to give some insights from your perspective on that.
Very interesting question, because that's one of the recommendations that we have been discussing about that comes out of our evaluation, so to speak. And I would answer that by trying to take it back to what we learned from SHARE and bring it back to now the COVID pandemic. Now, during the SHARE study, like I mentioned, we promoted hand washing with soap and water at different and crucial times. So what we did was to work with local producers of soap. Now, at first, like I said, we went through a session of learning and unlearning, and we initially started by having bar soap, which we learned that was not really preferred, but caregivers, so to speak, preferred liquid soap. So we ended up providing liquid soap, but that was a learning that we got during the process. Now, moving this into the public space, what we are learning is that when the initiatives were being set up, we had more of the distribution of bar soap. Now, as we try to evaluate this, we are learning that there's still that preference for liquid soap, even at the national level. So that already tells us that we can still engage the local producers of soap in producing liquid soap per se, if that is a preferred option, so that then we encourage hand washing with soap within the public space.
Thanks, Sheillah. That's great, especially to give us such a clear example of where you've been working on that as well. And I think it's fair to say there are lots of local producers of these different innovations and things within country, and it's a matter of supporting them and helping them to refine those innovations and market them as well. Jenala, since you like your urban sanitation, there's a question here which refers to the kind of opportunity that low middle income countries might have to leapfrog the kind of traditional wash infrastructure that we often see in the global north, and think about how we can innovate in our new designs for for example, using grey water for flushing toilets or for biogas production. I know that you are not coming from an engineering background, so don't worry, I don't expect you to comment on that, but I wonder from your perspective, if you want to give us an idea about how you think that could be achieved.
So I am happy to mention that these technologies have been tried. Specifically, we've had a large fecal sludge management pilot being done within high density communities, where you look at mechanical emptying of toilets using a pump, but we've also trialed biogas. So it's really how do we create value out of fecal sludge that's coming out of sanitation facilities. That's one, but also the type of toilet. So we have basic latrines, and the problem was, or is for a long time, our policy around sanitation did not cover unplanned settlements. And most of the settlements that are high density within the city are unplanned. And so you have people just building houses anywhere where there's no water reticulation, where there is no sewer system. So it was difficult then to regulate sanitation infrastructure in such settings. It's only now that we have a Ministry of Water and Sanitation that is looking at a sanitation policy, and that has been released. And this goes also for rural sanitation, because it's difficult to regulate those things. So certainly there are opportunities, but what I do know with biogas is that the demand was very low at household level. And one of the things that's being trialed or being considered now is trying to look at biogas for more industrial use than for household level. But there are certainly opportunities with fecal sludge management as well. Because of the unplanned nature of these settlements, it was difficult to pump out fecal sludge using a truck, because there are no roads that the truck can pass through, no road networks, or toilets themselves are not in a good state where you can put a pump out and pump out fecal sludge, because most of the stuff you get is sand and other solid waste products. And so as much as it would work in a very planned setting, it's a very different story in an unplanned settlement. And so some of the innovations are mostly traditional ways of removing sludge, like breaking the side of the toilet and removing the sludge out of there. But yes, we need to get more innovative about, how do we improve sanitation using local ideas on what works, especially with toilet design.
Great, thanks, Jenala. I'm going to combine two questions for you, Kondwani. The first one, asking if there are any particular failures that happened. Oh, Kondwani's turned his camera off. Any particular failures that occurred as during your share projects that you'd like to share, and then also whether you've revisited at all the areas in Malawi where you worked on the share projects to see if the interventions have been maintained during COVID and have helped to contribute to COVID prevention. I hope you heard me. No. Kondwani, did you get the question?
Sorry, my internet is very unstable here, so I missed the question.
No problem. Let me ask the second one again. There's someone asking whether you've gone back to any of the areas in which the share study took place, and to see whether the intervention is still working and whether it's been of any benefit during the COVID pandemic.
Thanks very much for that important question. I think it's really necessary to go back to where we have done the intervention to see if there's any progress. But to answer it short, we haven't done so in detail because we don't have the resources to support us to do that. But that's one of the areas that we really intend to do in case we have the resources to allow us going back there and see if there's any sustainability of the intervention that we implemented in 2018.
Okay, great, thanks. Maybe another one for you, Robert, just a bit of a wider one. I think in some ways, when we've heard from our partners in the Global South here about how they're engaging really strongly with a range of different partners in their implementation, I think there's a lot could potentially be learned from our Global South partners with what we're doing here in the Global North. And often we tend to be a little bit more inward looking in our academic institutions. What do you think we should be doing more effectively to learn from our partners?
Thanks. I think that there's a lot of various things we should be doing overall to learn more from our partners. I think kind of the first is providing more forums like this, where we can have partners from who have the direct experience that we're interested in, who have the insights of what kind of addressing these problems are on the ground are, and giving them a chance to speak up. I will speak from experience. I often get invited to kind of present at webinars, and I realize I'm from LSHTM, I'm, whatever. I think there's a whole audience here. We have people, they're people who have the expertise and the experience, and giving them a forum to actually voice that. I think we can also look at some of the examples of ways that people have gone about, kind of countries have gone about with their COVID-19 response. You know, speaking of this as someone who's currently based in London, where I think we have a lot we can learn from national COVID-19 response from what we consider kind of low and middle income countries. I think there's a lot of ways that we could leverage this experience. And I think a lot of the pressing issues are things that we're going to be confronting in the global north much more often. I think it's, you know, issues like hand washing promotion and all of that type of stuff that have been so central to COVID-19. We don't have the same kind of local expertise of people who are able to kind of leverage that skills and knowledge and apply those directly to public health problems. So no easy answer and no simple way, but I mean, you know, and ironic that I'm answering when my own answer is that, you know, other people need to be doing the talking. So yeah, I'll stop.
Well, hopefully this is the start of that dialogue with our three wonderful panelists, which is a perfect tie-in for me to say we're getting towards the half past. So it's been really great to hear from our colleagues who have been doing the work directly on the ground in Malawi, Kenya and Zambia and doing a fantastic job. And it's great to hear those difficulties and challenges that often don't get reported when we do academic papers or research briefs and those kind of things, and to really talk through the challenges and issues that are being faced there as well. And hearing about how you've really effectively produced evidence that has gone on to be incredibly impactful and useful as well in the countries and systems in which you're based. I am just going to throw up another couple of slides as we finish off for today. There we go. Just to draw your attention back to the COVID-19 Hygiene Hub. There are lots of great questions and comments around the COVID side of things, and I would really encourage you to have a look at the website for the COVID Hygiene Hub. The link is in the chat. It's got incredible resources on there, and it's really an excellent example of how a university can lead in helping to consolidate evidence across different partners and engaging with different partners and countries to support a global response. So I'd encourage you to have a look at that. Just a reminder that this is the first in a series of webinars, the next of which will be next Tuesday at the same time, and will be led by our partners in the University of Waterloo. And that will be focusing on university partnerships that Waterloo hold both locally, nationally and internationally. And then we'll be following those up in the subsequent weeks, looking at these wider issues around sustainable development and the role that universities play. So I just stopped sharing. It just kind of finishes for me to say a huge thank you to our fantastic panelists who made the time to come today. Thank you, Robert, for leading the panel discussion. And thank you for Jenala, Sheillah and Kondwani. Fantastic that we managed to maintain internet contact as well. And I think this is, it's been really helpful for everyone to hear directly from you how to work in this area. So again, huge thanks and thank you for attending, and we hope to see you at subsequent webinars.
Thank you.
Yeah.
Thank you, everyone. Thank you.
Yeah, thanks.
Thank you.